listen-only mode.
Hello everyone and welcome. This is Michaela Conley, HP CareerNet and Health Promotion Live. Thanks for being here. It's Friday again. Always glad when you can come and hang out with me. And today we've got Brenda Schmidt, Jason Lang, and Kathy Rasmussen from CDC and also from Viridian Health Management, and they're going to talk about the National Healthy Workplace Program. I'll introduce them here in a second, but let me say first, if you have questions, type them into the box, and we will do our best at the end to get to all those questions. And also, congratulations for your incredible interest in this. We've almost broken the record. We had just under 500 people register for this, so obviously there's a lot of interest around this topic. So let me introduce the presenters, not necessarily in the correct order. Brenda Schmidt is the president of Viridian Health Management, formerly Diversity Wellness, a population health management company that provides outcome-based wellness and disease management programs to organizations nationwide. Brenda has more than 25 years experience in healthcare marketing, health promotion, business development, strategic planning, and health coach training. Brenda has helped employers nationwide with hard-to-reach employee populations in industries such as trucking, healthcare, agriculture, automotive, manufacturing, and many others to reduce their healthcare costs by implementing effective health management programs. These programs have shown positive health and economic benefits through outcome-based incentive strategies, data collection, analysis, population health, and productivity analysis, program evaluation. Jason Lang is the team lead for the workplace health promotion, where he has managed projects promoting leadership for the CDC National Center for Chronic Disease Prevention, workplace health initiative since 2007. His responsibilities include the CDC strategic plan around workplace health promotion, acting as the coordinator among NCCD PHP division and liaison among CDC centers around workplace health, providing subject matter expertise to government, private sector partners, and working with models of chronic disease program investigation in the workplace. And work directly with the private sector to develop employee-based tools and resources for worksite health assessment program development and evaluation. Kathy Rasmussen is National Healthy Worksite Program Director for Viridian Health. Kathy is a National Healthy Workplace Program Director with Viridian Health Management. Kathy has more than 15 years experience working in the field of health promotion and employee wellness. Kathy has worked with a variety of organizations, including government-managed care, private sector, and not-for-profit organizations. Her expertise includes employee wellness, needs assessment, strategic planning, employee engagement, marketing evaluation. Kathy is experienced as a consultant, worksite wellness program manager, health promotion specialist, wellness coordinator, and on it goes. Obviously, a lot of experience in this virtual room. So I think we're going to start with Jason. Thank you guys so much for being here. I'm really looking forward, as are a whole lot of other people, to learning about this program.
Thanks, Michaela. I really appreciate you opening up Health Career Net to us today to talk about the National Healthy Worksite Program. We're really excited about this activity, and from the interest in terms of participation today, it seems like there's a lot of interest out there across the country as well. So between myself and Brenda and Kathy, our agenda for today is to provide folks with an overview of the program, including some of our overarching goals and outcomes of interest we'll be looking at. I'll also talk a little bit about the program reach and where we'll be doing the National Healthy Worksite Program. We'll turn over to Kathy to cover some of the program components in a little more detail and describe the activities that participating employers will engage in during the program. And then Brenda will wrap things up and bring us home this afternoon talking about some of the overarching elements that will be common to all the participating employers, like the national program evaluations and technical assistance activities, as well as give you a sense of the administration and timeline for the overall project. And then we'll let you know at the end ways that you'll be able to stay informed as we go, mechanisms, upcoming events that we have, and some of our immediate next steps. We initiated this project on the 1st of October of this past year, although significant planning was done much earlier this year, and putting out funding opportunities to get us to this point. Originally we put this out under a solicitation that was called the Comprehensive Workplace Health Program to address physical activity, nutrition, and tobacco use in the workplace, which was a mouthful for anyone and didn't, like many other CDC programs, translate into a really catchy acronym that we could use. So I'm thankful and happy that we're now referring to this as the National Healthy Worksite Program. It's a lot simpler to understand, hopefully, and use, that's essentially how we'll be referring to it going forward. As Michaela mentioned at the beginning, two of our main partners in this will be Viridian Health Management, who will do a lot of the programmatic support for this, as well as Research Triangle International is heading up our national evaluation efforts for the program. We also have a number of other CDC programs and subject matter experts involved, and we'll be reaching out as we get into the local communities that we'll be working with in terms of developing a number of additional partnerships and collaborative opportunities. I wanted to start with just some general principles that we're applying and using in this program, and they're really discussed on this slide. We would like this program to be as comprehensive as possible, and what we mean by that is we envision the participating employers here to be able to implement multiple strategies to engage both their employees and also have an effect on their work organization. So we'll be looking to put in place a combination of approaches that involve behavior change programs, organizational policy, environmental changes, which could either be to the physical built environment and or the social environment. We also think a comprehensive program in terms of utilizing interventions and strategies that will address multiple disease risks concurrently or simultaneously. While the focus of this program will be on physical activity, nutrition, and tobacco use, many of us know and appreciate and understand that addressing those risk factors can have a profound effect on other disease risk, including a number of chronic conditions that my center in particular addresses, like diabetes, heart disease, and stroke. And lastly, we want this to be comprehensive in terms of engaging and impacting all levels of the organization. So from the frontline employee to the middle manager to the senior leadership, and thinking about the entire organization kind of as a living, breathing entity. The strategies and interventions that we're looking to put in place here will provide a number of opportunities to engage on all those different levels of the organization. Given that chronic diseases are, the leading cost drivers for many employers across the country, as well as the nation as a whole, it makes good sense that one of our overarching goals is to reduce the risk of those diseases. And in this particular instance, we're utilizing the workplace setting as a place for intervention to get to employees and their families with science-based interventions and best practices. We're also going to be capturing a lot of process and outcome evaluation information, principally using the REAIM framework, which we hope will help us to better understand sustainable and replicable practices so that the efforts of the employers who are participating here will be able to sustain and continue what they're doing after the program ends. Part of that process and outcome evaluation, we'll also look to document unique challenges and barriers for employers, particularly the smallest employers that we will have as participants, so that we can further develop models, best practices for health promotion in the workplace. And lastly, we have as a goal to really want to promote peer-to-peer mentoring among the employer community. Obviously, we'll have direct participants in this program, and we'll work to create opportunities for them to engage with one another in mentoring. But there's a much broader employer community out there that we would like to be able to make aware of what we're doing and share lessons learned as we go. We think we will definitely have a lot of stories to tell over the process of implementing and evaluating this program, and in capturing and sharing that information, we hope we have a number of employers who can serve as role models and peer support for the larger business community. In terms of program outcomes, at the end of the day, we hope that participating worksites have a high-quality workplace health program in place, and that means that all the elements that we will be working on implementing are present and working effectively, and those are things that Kathy will talk about here in a moment. We hope to take employers on a journey over a 2-year period, and at the end of the day that they're in a much better place to be supportive of health promoting activities of their employees, so that behavior change can either be initiated or maintained and continue to be supportive. So aspects of a culture of health, developing that and sustaining that is an important outcome for us. The elements that make up a high-quality program, as I mentioned earlier, we look to have combinations of programmatic, policy, and environmental support strategies. Having those things present at the end of the day will be a key to our success. Again, with respect to the process outcome evaluation, that we are capturing and reporting key success drivers for not only implementing these programs but sustaining them over time. And that for both employers and employees, that their level of knowledge, their level of skill, their awareness of activities going on in the worksite or in the broader community has been raised at the end of the program. Linkages have been made to community resources, and all for the goal of trying to increase access and opportunity to, again, initiate or maintain behavior change. In terms of our program reach, we're looking to engage up to 100 employers to directly participate in this program. We've categorized them into 3 different size groupings. Our smallest group of employers will have less than 100 full-time employees. Our medium-sized group will have between 100 and 250 full-time employees. And our largest group will have more than 250, but less than 1,000 employees. Within the total group of employers, we're looking to have approximately equal numbers of each of these 3 size categories. So roughly 1/3 in the smallest group, roughly 1/3 in the medium-sized group, and the last 1/3 representing that largest group of employers. In total, we feel that this size of employer from 1 to 1,000 is probably the most underserved employer population in terms of these workplace health programs. And so in terms of executing the strategies we have in mind, we think they will clearly benefit from the activities that we have proposed, but that's not to say others, whether they are larger or find themselves not being able to participate in the program, won't have opportunity to benefit from the lessons learned and the tools and resources that might be developed outside of or within the program itself. Once we have our participating employers, we're going to operate the program in 7 local program sites. From an administration and management perspective, in terms of ensuring a lot of on-site activity with participating employers and really enabling us to help build that knowledge, skill, and capacity among employers that don't have a lot of experience when it comes to these programs. It's essential that we are able to work with them directly on site as much as possible. So we'll concentrate groups of employers in 7 localities, and each of the groups of employers will be no more than 15 employers in total. So that, when you do the math, will add up to 100 total participants. And then within each of the single 7 local sites, the employer group of up to 15 employers will consist of all 3 of the size categories that are mentioned here. So any one individual group will have a couple representatives from that smallest employer size grouping, from the medium-sized employer size grouping, and from the largest employer size grouping. In terms of where the local sites will be, we have divided the country up basically into different geographic regions. We very much want to, at the end of the day, have geographic diversity, cultural diversity, demographic diversity, and industry sector diversity represented among the participating employers and the employees that make up those companies. So one way to do that is to ensure that the 7 locations that are selected are sprinkled out throughout the nation. And so at first cut, one way to kind of divide up the country is represented in this map. So at the end of the day, what we'll have is a group of up to 15 employers representing the Northeast region, the Southeast region, the Upper Midwest, kind of the South Central part of the country, the large swath in the middle there of the plains, and then 2 areas representing the West Coast. In terms of how the specific localities will be determined, and when we say locality, what we're pretty much talking about here is a city or county level, which again will speak directly to how we can effectively administer and manage a program, provide those mentoring opportunities, ensure that we have an on-site presence, and be able to link effectively to community resources. We'll apply some of the following criteria. One criteria is to look at localities that have a high prevalence of chronic disease or the risk factors of interest to the program, so high levels of obesity, high levels of tobacco use, diabetes, etc. We also want to look at communities that have available resources to help support and sustain program efforts of the employers, not only during the program itself, but once the program concludes. So we'll be looking at things like access to acute care hospitals, existing community health initiatives or programs. We'll be looking at CDC-funded state or community programs, non-CDC funded state or community programs, organizations like the Y of the USA, business coalitions, worksite wellness coalitions and groups, any and all of those kind of things that can provide potential linkages to the employers participating in the program. And then we'll be looking to make our site selections and give some preference to communities that will help us ensure that we have a rich diversity amongst a number of different factors, whether it is health disparities, whether it's ensuring that we have a mix of both urban and rural localities represented, demographic diversity with respect to age or socioeconomic status of the employees themselves, and that we have a number of different diverse industry sectors represented will all be used to determine what the 7 localities will be. So at this point, that's kind of the introduction and overview, and I will turn it to Kathy, who will take you through some of the specific program components.
So thank you very much, Jason, in setting the stage for what's going on with this program. It is very exciting to be part of it and look to all that it can accomplish. And what we will do is incorporate different programs and components that will make this very successful. So as we look to the program components, each employer will build a core workplace health program which will include these components. And this is really designed, again, as Jason said, for that stability, sustainability, and to achieve the goals of the program. We're going to start out, and I'll go into these in more depth, with each of the different steps that will be taken. And the first step will be the assessment of the employer, and this is and employee needs, and it's very extensive about what does this profile really look like for this particular organization. So assessing what those employer and employee needs are based on the interests, based on the health risks, and what is their existing capacity. The next step will be to move into that planning process where we examine exactly how we're going to do this. You know, what are we going to do on a long term? What are we going to do on a short-term basis? And again, what can we do to make this particular organization have a worksite wellness program that is very sustainable and particularly customized for their organization?
Kathy, can I interrupt you for one tiny second and ask you to
Sure.
Speak up? Your volume is a little low.
Okay, I'm sorry. Is that better?
That is better, thanks.
Okay, I'm sorry. So with the implementation of the program, we will be putting in policies in place as well as practices to address these lifestyle risk factors that are related to physical activity, nutrition, tobacco use, and building then an infrastructure, what I call kind of the Sim City of the organization and wellness program within each of these work sites for both a short-term and long-term sustainability, including the evaluation, those wellness committees, strong program champions, and then the leadership support. We're looking for the participation in programmatic activities. We'll provide training and technical assistance along with extensive evaluation of both the individual, employee, and organizational improvements. So beginning with the assessment, what we want to do is look at the employee needs, their interests, health risks, capacity, and at the individual level, the National Healthy Worksite program will utilize a health risk assessment to look at the elements of employees' health. So this may be their health behaviors related to these different conditions and activities, where they're at with their nutrition and tobacco use, and also looking at contributors to chronic disease such as high blood pressure, overweight, and obesity, and their current status. Taking it to the organizational level, the National Healthy Worksite program will assess the elements of the workplace structure. What does it look like culturally? What are the practices that they have in place? What are the policies related to health and safety? And take that into consideration in very strong development of that sustainable program that belongs to the organization. So the environmental elements of the physical workplace are the facility settings where those employees work, what kind of atmosphere is there, what access do they have, what opportunities for health promotion are provided by the surrounding communities in which they live. So the planning and infrastructure is really where we see that employers can make a big impact based on this planning and infrastructure. So in developing that health program, we want to set the goals with this planning process, determine the priorities, and build that organizational infrastructure, which will include a strong and broad representative workplace health council, wellness committee to involve a number of different entities within that particular organization, looking to the site level, health promotion champions, and building very active champions and those who can be models to others and really infiltrate the organization and make it alive within that organization. The community linkages are very important in that sustainability, and we'll be creating the partnerships between those communities and leveraging those community resources to make sure that there's ongoing programs and that there's a flow back and forth with the different community partnerships that they can develop. The site level work plan will be in place, and again, to develop that infrastructure, we'll look at the promotion and marketing of the program. Very important that that program is marketed to the employees, promoted in a number of different modalities. So when it comes to implementation, this is kind of what I call where, the spokes of the program take traction in moving this program forward and keeping it rolling. So the implementation will include those policies, practices to the employee lifestyle risk factors, and related to physical activity, nutrition, and tobacco use. They will be made available to the employees for at least a minimum of 12 months and reported to the senior leadership and gather that information and make sure that it's transparent and can be easily recognized by everyone within the organization. And developing those social support systems, which is basically the community within the community, so that we can have the things that are there that make this progressive, and wherever that employee is at or wherever that employer is at, the system is there to support them. And tracking, of course, all along the way of the program goals. So here's some of the intervention examples. There'll be a full range and multitude and modalities in which the employees can access these program interventions. So they will include classes, seminars, weight management programs, tobacco cessation, coaching, counseling around lifestyle, lots of signage regarding the health promotion components, and information resources galore. So the policy intervention examples, these are the things that make the ownership and sustainability of the organization. It's kind of the who we are, and gives people a setting in which they can feel very comfortable about what the expectations of the organizations are and how we do business. So that would include tobacco-free campus policies, for example, healthy foods at meetings, looking at what kinds of foods are available, making sure that those are healthy foods, that they're nutritionally dense, policies, creating flex time, supporting the employees in engaging in these activities and behaviors. The environmental support that's going to be available to them is looking at fitness facilities, everything around them that they can access, and access that in a very easy way so that it is available to them in a number of different ways. And one of those would be to establish an on-site farmers market, for example, making sure that they are aware of and use the recreational opportunities that are there, make sure that that organization is free of health and safety threats, and having a way to identify that, making sure that those problems are solved. And again, this is a picture, a living thing, as Jason said, that goes forward and is the way we operate within our business. It is who we are. So there'll be very extensive program evaluation all along the way with this program. And we will be assessing a number of different things very specific to that organization and specific to what the improvements are, looking for improvements in all these areas. Where are we at based on that assessment that we did, what kinds of things that we implemented, where our benchmarks are, where we're seeing individual changes in all of the different aspects, such as the environmental aspects, looking at the programs that are available, the policies that are in place. So also improvements in employer health and safety culture. We'll measure and evaluate employee productivity and certainly how that affects the functionality of the business itself. From that, we want to really call out what are the best practices, what is the mold, what is the way that we can bring this forward ultimately to the employers across the nation. And then we'll document those unique challenges, because in each organization we know that it is unique in and of itself. There is no apples to apples. So what are the challenges, barriers? These are the learning lessons that we have from each other, from the employers, and develop those strategies to overcome them. And from that, this will be a model that will be sustainable within that organization. Again, we can all learn from, tie in, and have the resources from the National Healthy Worksite program. So now I'm going to turn this over to Brenda, and she will talk about the National Program Evaluation components and more about the timeline.
Okay, let me get this back to where we were here. Sorry for the delay. So as Jason mentioned, in addition to Viridian's evaluation or ongoing evaluation of the program, a separate evaluation contract was awarded to Research Triangle Institute that it really is an integral part of the program and is going to provide ongoing evaluation throughout the program. So whereas our program implementation is 2 years, the program evaluation contract is actually 3 years, because I think one of the key learnings from this is are these programs sustainable after the 2-year project period. So they will come back in after the third year and say, what have these programs continued? Have they improved? Have they gone away? But I think that Research Triangle International is also a very integral part of the program on an ongoing basis, as Jason mentioned, in terms of capturing those key learnings. So what are the key success factors? What are the barriers to success? If we have a certain timeline and we're not meeting it, what's going on at the employer that is sort of derailing this? And so I think, as opposed to just saying this is what you should do, I think what we're going to come out of the program with is this is really what the user experience is. And because, as Jason mentioned, there will be a variety of demographic companies and industries that other employers that aren't necessarily participating in the program can find someone that looks like them and sort of go through that user experience and be able to relate it to their own implementation and ongoing efforts in establishing worksite wellness programs. So the key learnings from the program through RTI will be disseminated through manuscripts, case studies, and success stories that will be available on the program website. I think one clarification, this is not a grant program. It is so that we will not be administering grants or monies to individual employers or organizations to administer the program. So we will be doing all the programmatic implementation here from Viridian Health Management into those employers who are participating in the program. So I just wanted to clarify that. However, again, we'll talk a little bit about the technical assistance in the organizations that are not part of the more intensive effort. We'll certainly have many opportunities to understand those key learnings and follow along in the process. For the program timeline, Kathy did a great job of outlining the program components. This is the timeline right now. We are in month 2, as Jason mentioned. The contract started on October the 1st. This first several months is really about identifying the locations where we will establish these groups of employers, establish a pool of certified employers that meet the inclusion criteria, and then once we have a pool of certified employers, then we're going to conduct phone interviews to select the final employers based on those inclusion criteria. I know there's a lot of interest about how we're actually doing that, and I would direct everyone to the website that we'll get to here in a little bit. It does have detailed, frequently asked questions about the program that does include what those inclusion criteria are. So those are the activities months 2 through 7. As soon as those, the cohorts will be announced by the end of this year, and then once we're into months 7 through 8, it's really when we have the opportunity to then go on site and create the steering committee and the wellness champions, start doing some assessments, creating those community linkages, and then we'll actually start the employer assessment and planning in months 8 through 10, create those individual worksite wellness plans, and have a year of programmatic intervention where we'll actually be implementing the programs that Kathy described, and then still have an opportunity at the end of the program to then do a post-assessment around organizational culture and individual risk to see what improvements we actually made during those 12-month period. There will be, in addition, ongoing evaluation throughout the program, so there is a very robust pre-post. However, again, it's very important for us to be capturing these key learnings along the way and evaluate on an ongoing basis. We expect that employer interest in this program will far exceed the ability for us to administer this in the 100 work sites. So realizing that, we really encourage non-participating employers, whether they are located in one of these groups of employers in a particular region, or they're located outside of that county or city where the programs are being implemented. So one of the things that we're very committed to with CDC is to provide technical assistance to non-participating employers. So those technical assistance opportunities will be multiple and include webinars, email distribution. So those of you who have registered for this webinar will continue to receive ongoing newsletters and links to ongoing webinars, opportunities to plug in. If there are employers located in those regions that are not participating, there will be opportunities within those regions to participate in local training and programs. There will be distance-based learning opportunities, as well as, again, ongoing resources and tools available through the program website. So we very much want this to be, again, as Jason said, a journey through this, whereas non-participating employers do not need to wait until the end of the 2-year period to start doing some of these things and learn as this program moves along. So the tools associated with this program are all public domain. They will be available through the website, and so the website will be a resource, an ongoing resource, and things will be posted as soon as they become available as we move through this process. Again, the program website is posted here, cdc.gov/National Healthy Worksite. You can also get there through cdc.gov/NHWP. They both go to the same place. At this point, the website includes a copy of this PowerPoint presentation. We will archive this with audio and video to the website as well if you have colleagues that perhaps missed this presentation and they want to view it at a later date. Again, as I mentioned, the program frequently asked questions are currently posted to the website, and the tools and resources associated with the project will be posted there as well as they become available. So I encourage you to stay connected. The other way to stay connected is through the program mailbox, which is National Healthy Work at cdc.gov. So if you do have additional program questions that are not answered in the frequently asked questions, they're not answered as part of this or future website or webinars, and you want to have those answered, feel free to email that mailbox. You will get a reply. Or if you are just interested in receiving ongoing information, you can email that program mailbox as well, and we'll capture your information to make sure that you stay connected as the project continues. So the website is the best source for program information and ongoing technical assistance associated with the project. We are having some future webinars. Don't worry that you have to copy down these long URLs. It is possible to register for these future webinars by going to the website, again, cdc.gov/National Healthy Worksite. We are having our next webinar on December 20th from 2 p.m. to 3 p.m. Eastern Standard Time. That will largely be a repeat of this general program overview webinar for individuals that were on a different time zone or could not make this webinar. So largely, again, a repeat. However, there are future webinars scheduled in January for the 13th and the 20th. And in those webinars, we will be announcing the cohort or the region locations, as well as the specific criteria and timelines and next steps around employer selection, and again creating that pool of certified employers. So we expect additional interest and participation in those January webinars as well to really understand the selection process for employers. Once the certification form is available on the website after the first of the year, that will be the place where employers that meet the inclusion criteria can go to complete that certification process. There will be a Federal Register notice, and again, the Federal Register is another place to get detailed program information. There will be a Federal Register notice posted within the next week that will discuss the purpose of these webinars. The second Federal Register notice will be posted in January that is going to discuss the selected locations, the eligibility requirements for the program, and the process for selecting both locations and employers. So those Federal Register notices will be ongoing as the project continues as well. So I will turn it back over to Michaela. That's the conclusion here, and see if we have any specific questions that we can answer in our remaining time.
Great. Thanks so much. A lot of really great information. Okay, yeah, we do have a bunch of questions. I guess the first ones are for Jason. A couple of different people asked, Jason, what was the name of the framework you referenced?
The name of the framework?
Oh, the REAIM.
For evaluation, it's REAIM.
Can you?
RE/AIM. If you do a Google search for that, you can get to Ross Brownson's work. He's done a lot on REAIM and learn about the different aspects of it. Essentially, it looks at the reach of your intervention, the effectiveness of your intervention, how it's implemented and adopted within your organization, and then how you can maintain it over time. So as I think the three of us today talked about quite a lot, was our desire to have these efforts not only conducted over the next couple years, but sustained into the future. And REAIM is a really good framework to look at what are the key critical elements needed to not only have those activities implemented, but adopted and maintained over time.
Great. Let's see, here's a quick one from Nedra. Is this at all connected with the Kaiser Permanente group?
No.
No, not at all. Okay. All right, here's another one for Jason. Mari asks, or says, the Affordable Care Act called for small business wellness program providing grants to businesses implementing comprehensive programs. Why did the CDC choose to extend the programs to medium and large businesses rather than focusing just on the small businesses?
That's a good question. Thank you for asking. I think it's one of the issues that we addressed in our FAQs, so if I don't hit all the detail here today, you can refer yourself to those aspects. But the small grant program that's part of the Affordable Care Act was authorized, but there were no appropriations given to it. So while CDC has had an interest in working in worksite health promotion for some time, we wanted to look at that aspect of the law and see what aspects of this particular program could reinforce or create synergy with those things. In terms of moving it above the smallest employers, as Kathy talked about in terms of the example interventions that are available, there are a number of either programmatic activities, policy, or environmental support activities that may not be practical or feasible for very small employers. Some of the cafeteria interventions might not have cafeterias present in the very small employers, or things related to on-site fitness facilities, again, may not be a feasible intervention for the very smallest employers to pursue. However, there is evidence and support that those types of interventions can be very effective in helping to drive behavior change and health outcomes for employees. So by extending the range to larger employers, up to 1,000, some of those interventions may be more practically feasible for them. And because of the peer mentoring groups that we're looking to create, may be able to discuss some opportunities or strategies that the smaller employers can create bridges or connections to having those things more available to them outside of formally constructing something like an on-site gym or building a cafeteria.
And I think, Jason, can you address too, I think there is some confusion about the funding mechanism, that this is not funded out of that, that grant mechanism for small businesses.
Yeah, I'm sorry I might not have been as clear about that, but that specific provision of the Affordable Care Act, CDC did not receive funding to execute that, so that may become available in future years, and certainly if directed by Congress to do so, we would execute that provision and directly make available those opportunities to employers. Great.
Bill McPeck, good friend, hi Bill, would like to know what model will you be using to develop the worksite champions?
We've looked at existing social structures, especially around safety, and we really haven't touched that, but we feel very strongly that safety and worksite wellness really need to be married. So typically what we will do is socialize the program through any existing safety committees and then expand that out into a separate wellness champion team and use a peer health educator model to expand the reach of the program through those champions.
And I think also there is, as we do the employee interest survey and talk to the employees more directly and see what they're interested in, I think there's definitely opportunity to foster and empower them to take that to the larger employee group and feel like they have that support and bring that to other people, because it's the buzz a lot of times that makes a difference in the wellness program and having people engage in it.
Yeah, and building on that, Kathy, what I'd add to the champion issue is, we can have a number of different champions. It's not that any one of these participating employers is limited to identify one single person, but some of the characteristics of those champion folks are one, do they have some clout or decision-making capability within the organization so that they can move forward policy changes or organizational support changes or other aspects of the program? Are they enthusiastic and motivated about promoting the activity, and are they actively involved in participation themselves so that they're a good role model for others within the organization? Those folks can come from various levels. They don't have to be necessarily in the C-suite or in a particular business unit of the company. And so I think, as Kathy said, through the needs and interest process, we'll look to identify people who have those kind of characteristics and work with them intently to capitalize on their maybe natural charisma and give them additional skills and knowledge to be able to promote these activities in their organizations.
Great. Let's see here. Robin wants to know, will there be incentives for employers to participate in the program?
We are not encouraging employers to provide robust incentives to participate in the program, because we want to be able to show outcomes with the programmatic and policy and environmental support interventions, as opposed to and evaluating engagement in the program without sort of clouding the assessment and evaluation based on a dollar value. So we have established a grid, if you will, of different incentives that we can capture to make sure that we are evaluating those as part of the overall evaluation of the program. But certainly no program funds are going towards incentives. However, if individual employers want to offer T-shirts or certain types of smaller incentives to encourage participation in the program, those are okay, but there are no specific plans to encourage folks to do any type of premium differential or financial incentive associated with it.
Let's see, here's a question from Joan, wondering, does the Research Triangle project start when you're finished, or when?
No, it has actually already started. They're a very integral part of the program already. We've harmonized all of our assessment tools with them so that we're all using the same pre-post for the beginning and the end of the intervention. So no, it has already started.
Okay, great. Let's see. Someone asked, now I've got to find that question again. We actually have a ton of questions. Patricia, if an employer already has a minimal wellness program, for example, yearly blood draws, would they be eligible?
What we're looking
Yeah,
for,
I mean, this will be one of the topics that we'll cover in that series of January webinars that talk specifically about criteria for employer participation. Obviously, a fully robust program that an employer has wouldn't be really someone in great need of the kind of programs that we're looking to implement. So something on par of what we're doing, I think, would exclude that particular employer. However, most employers out there have some kind of wellness activity as part of their organization. So minimal elements are not going to exclude individual employers from participating.
Okay. Can you comment on any accessibility regarding, accountability, sorry, regarding the success of the program? For example, as a team leader, is Jason being held accountable, and so forth? How? What about Viridian and the program managers? How does that work exactly?
Well, we've clearly outlined what our program outcome measures are, and all of us working together will all be accountable to achieving those program outcomes. We have a number of different reporting requirements that will be sharing this with our leadership here in the agency and with the Department of Health and Human Services. So as this program goes, we'll all be held accountable to the success of it. Absolutely. Okay.
Laura would like to know, how do employers apply to be a part of this? Because she thinks there's probably employers on here that would like to be in the pool. I think is that on Viridian's website?
It will actually be on the National Healthy Worksite website beginning, we're expecting it sometime in January. So don't look for it now, it won't be there. The first step in the process is establish those regional or those selected sites. And one of the criteria for becoming part of that pool is that the employer is located in one of those 7 city, county localized sites. So, but again, the webinars in January will clearly outline that, as there are some additional information about that on the frequently asked questions on the website right now as well.
Okay.
Yeah, I would treat the January 13th date as kind of the kickoff event for the employer participation process. At this point in time, we have not taken anyone's information or have created a database or a pool of eligibles at this point in time, so nobody has missed out on any opportunity at this point. We wanted to take the remainder of this year to do some general overview, informational opportunities to kind of get people some familiarity with what the program will be, and then that month of January will really be the intensive process by which we'll be reaching out to employers to let them know specifically what will be involved on their end in terms of participation.
Now, you may have already said, if so, I apologize because I missed it. Have the 7 regions been selected as of yet?
No.
No, we're in the process of applying the criteria that I briefly alluded to earlier, and so looking through various databases, looking through county health ranking data, national surveillance system data that we have on some of the health outcome measures or prevalence estimates, connecting with different programs here at CDC and outside of CDC to learn more about their local health programs or initiatives, and setting up and reviewing census and Department of Labor Statistics data to look at some of the interested areas in terms of their industry sector, how many employers are in those locations, so there's a sufficient base of employers to be able to support one of the groups.
Okay. Krishna was wondering, there's been significant research recently demonstrating that sedentary behavior is not offset by meeting normal physical activity recommendation. Your model specifically focuses on physical activity. What will you do to promote less sedentary time at the workplace?
I think sorry.
No, that's all right.
One of the things that's happening is that as the employees go through their health assessment and really connect with this program in and of itself, there's going to be an opportunity to tie into what's going on with that employee on an individual basis, help them through the coaching process. But as you mentioned, just being sedentary is a problem in and of itself. But if I start setting the atmosphere for what's around me, that will also help offset, so to speak, what's going on with any kind of weight gain or perpetuating that. So if I have policies that have a healthy vending program, I don't have unhealthy foods just naturally available within the organization, if I develop that stretching program, if I encourage breaks, those are all things that help people get up and not necessarily be going to the gym, but being able to do things that help them with not gaining extra weight, even if it's not something where I'm going out and walking for an hour after work or after my evening meal.
Mm-hmm. Great. Well, we have probably 30 more questions, so I'm going to ask Kelly to forward all these questions to you so that you can, along with all the participants, of course, but so that you can follow up with people and keep people in the loop. I am so really impressed with the number of really good questions that people have had, and and the amount of excitement there is around this project. So I, along with 500 of my closest friends, are really looking forward to hearing more on this ongoing.
Michael, thank you for the opportunity and your reach into this marketplace for us. So appreciate it.
Oh, you're very welcome. Well, thank you all for being here. Have a wonderful weekend, and yeah, do keep us posted because we're all very interested in this really awesome project. Take care.
Certainly will. Thank you, Michaela.
Bye-bye.
Bye-bye.